Today I'm going to show you how I use the iTero in myitero.com, also for planning cases myself and also to communicate with my technicians. So for my technician, it's quite helpful to sometimes have a live going through what it is I'm actually looking for. So in this case here, we might want to tell the technician something about the occlusion that I otherwise could send the static pictures from off. That's fine. But I also find it's nice to sometimes show him exactly what I want to point out. So if I was to say, look, there's a lot of tooth wear here on these front teeth, and that's something we particularly have to pay attention to, then I can do a live sort of recording just on a phone and then just send that over to him per WhatsApp message, and he actually understands better than just a static picture. STL files are great, but I think it's very nice when you can explain something for the technician as well. That's only helpful. And when I'm planning cases myself, I also like to have several screens up at the same time so that I can see different viewpoints with different angles. I might want to see multiplied at the same time. It just is very helpful when you have different views all available at the same time when planning cases out in your head. And of course, the great thing is I can do that when the patient is gone. So I have time to do this in my own time. So let's say I wanted to plan a case for ortho. Then I have the outcome simulator here on the iTero, and I could look at that. But at the same time, I might want to have a closer view of the actual clinical pictures. So I can see the tooth wear a little bit closer. And if I wanted to use NIRI or if I wanted to use the multiplied at the same time, I can do that as well. So I find it's often helpful to have more images and more views of the same patient off at the same time.